Good afternoon at magandang hapon po sa ating mga viewers sa DOH Facebook at YouTube pages saan mang bahagi ng bansa. Ako po si Nikki Cesario, isang Juana mula sa Kagawaran ng Kalusugan, and welcome to today's Kapihan with Media, serving a special blend. Before we officially start our discussions for today, we will be reading our house rules. To ensure the smooth flow of our session for today, everyone is encouraged to, number 1, use the naming convention below for Zoom usernames to ensure proper acknowledgement. Number 2, pay attention to the discussion of our health experts and or resource persons. Number 3, keep your microphones muted while speakers are discussing and presenting. Number 4, next slide please. Should you have questions, participants shall signify and send them in the Zoom chat box and wait for the host to acknowledge them. There shall be an open forum after the discussion. Submitted questions will be addressed first by our experts, followed by Zoom chat box questions. Every participant is advised to reserve questions. Only questions related to the topic discussed will be entertained. Join the meeting until the last part of the session. So since we are celebrating the World Immunization Week this week, we have with us today the lead for vaccine preventable and immunization from the World Health Organization, Dr. Robert Quezala, to discuss with us the world and local data on vaccinated children. Good afternoon, Dr. Quezala.
Hello, good afternoon, everybody, and thank you for the invitation.
Thank you, Doc. We will be pulling up your slides in a while. Yeah. You may take it away from here, Dr. Quezala.
Yeah, thanks again, Dr. Anna, and all colleagues, participants, and invited guests. I was asked to talk about the subject of bridging the global and local perspectives on immunization. I would like to first introduce that. Why do we talk about the global immunization as an issue? Immunization is a bit complicated in that there is collaboration on manufacturing vaccines, transporting them from one country to another, from manufacturer to at a place of consumption. And because they are biological products, quality control is much more complicated. You can manufacture an aspirin by mixing ingredients, but producing like a live or PCR or even a killed vaccine, I'm trying to make it very simple, or even a mRNA vaccine is a bit more complicated. And so for that reason, we tend to have a lot of collaboration across countries. But that has other implications in that monitoring is also done at a global level. Almost there is an obligation for each country to report and be answerable to international standards. I don't want to say, but you may find that if Philippines treats diabetes in a particular way, yes, there can be some guidance based on the WHO recommendations, but nobody asks many questions. On the other hand, everybody will be asking if Philippines does not report how much it did on immunization in this or that vaccine or COVID or measles, this is questioned, and the Philippines knows it. Not only Philippines, so all countries collaborate this way. Because also the immunizations tend to prevent diseases which are infectious and hence can cross borders, there is a tendency to have interest in whatever happens in every country, and these are reported to WHO and then eventually shared across the countries for different ministries of health or departments of health to understand what is going on. So this is the first context of the global perspective. So next slide, please. This is a bit busy but bear with me, I want to walk you through it. Let me start on the table on the right, in that in 2021, how many countries had so many unvaccinated children, and the score is given 1 in color, and then in the rank, the country itself, the DPT 3, and then the number of children who are unvaccinated. Let me first explain, take a step back and explain. DPT 3 is a vaccine which has it prevents 3 diseases: pertussis, diphtheria, and tetanus. And it is given the first dose is at 6 months, the second is at 10 months, 10 weeks, 6 weeks, 10 weeks, and 14 weeks. What is the significance? If a child is born in a hospital, they tend to get 2 or 3, polio, BCG for tuberculosis, and hepatitis. So that means the program does not make a lot of effort because it is given at birth and hence it's easy. But a dose which is given at 6 weeks, it means the immunization program has reached out, or the mother has reached out to get vaccinated. So DPT1 is a very important marker of where the immunization program is performing or not. And then when you get to 2 or 3, it means you are keeping whoever showed up at the beginning is showing up on the second dose and maybe showing up on the third dose. So here, when you see DPT1, which is the vaccine given at 6 weeks, it is a measure of how much the program, it's international, it is recognized as much as the program is doing something, rather than vaccinating in a hospital because the mother delivered in a hospital and then went home. Okay, after 6 weeks, did we find the child, or did we provide the vaccines for the child? So that is why you see this is DPT1 and its significance. So you look at countries, and here I want to take you to number 5, rank 5. Philippines is among the countries which in the 20, they are not doing so well. And if you look across to the 4th column, which is DPT1, you will see that Philippines is less than 60. So all the countries which have maybe green have achieved 80% or more. All the countries which are yellow are below that, and countries below 60 are marked as red, or that color, let me call it red. So you find that the Philippines is in the category with Angola, Myanmar, Somalia, and North Korea. Now, a country like Philippines, with its capacity and so many people, this is unacceptable. So again, we look at the data globally. We go through how many countries are performing well or not so well, and then together we try to stimulate through international collaboration across countries, through WHO, through UNICEF, other partners, and through even country-to-country collaboration to improve wherever those countries are not doing so well. So that is the DPT3 one, that is on the right. On the left is DPT3 coverage and 0-dose children. And again, you see in Africa, you have that big countries, Angola, you have Somalia, you have Myanmar, and then you have the islands and the DPRK, or North Korea. So this means, again, that even among the children which they find, that is DPT1, keeping them in the system of immunization, that is DPT3, to give the second and the third dose, Philippines is not doing so well. And this is something that we do not want to see, and we would like to work together to ameliorate. So I've tried to explain this slide. It's a bit busy, but that is the main message that we'd like to bring out. And how did this happen? So we had a regression in immunization performance in about 100 countries, which was associated with the COVID-19 pandemic. Various reasons, a focus, health workers busy, a restriction of movement, population anxiety to maybe we'll catch COVID if we go to health centers, and financing also, money which was channeled away from the regular immunization activities and put into COVID vaccination, which was right at that time because the whole population was at a threat of disease. But then it has a problem that it takes away from the normal immunization activities. Next slide, please. Again, then you look that in a, okay, let me step back. Let me take a step back. WHO divides countries into 6 regions. That is, you can have the Africa region, we tend to hear it Afro, the European region, Europe, the Americas, either PAHO or AMRO. And then here we have what we call the Western Pacific. These countries are close together geographically. They also have the tendency to have epidemiological disease patterns, and also economic performance tends to be similar. So Philippines is in what we call the Western Pacific region, which is with Japan, Korea, Australia, various countries. And if you look at the WHO UNICEF estimation of coverage in Western Pacific, so the graphic on the right shows since 2000 that immunization with the first dose of measles, because there's supposed to be 2 doses of measles at different, in Philippines is at 9 months and 12 months. Other countries give it at 9 months and then at 15 months. But the difference is minor. You see on the left in the red trend, the increase in immunization with measles first dose from about 80% to the ideal, what we would like, and we're very happy to see that by 2007, about 90%, just over 90% coverage, which was excellent because measles is highly infectious and needs very high coverage for protection. But around 2009, we convinced the countries that a single dose of measles is not enough. So almost all the countries all over the world started adding a second dose. So for Philippines, it was at 9 months and at 12 months. Other countries at 9 months and at 15 months, or in between there. So around 2009, all countries of the Western Pacific started adding a second dose to give 2 doses of measles containing vaccine or MCV. So you see that the first dose, which is given around 9 months, continues, but then it starts falling around 2014 to even below 80%. On the contrary, the second dose of measles vaccine starts rising, what you see in yellow here, and then both of them are around 70%, and then the pandemic hits 2020, 2021, and that is where you see both of them, measles type first dose and second dose, all have a dip, which is what we don't want to see and which is associated with the pandemic, which I have explained before. And that is why we have launched as WHO 2023 as the year of catch up on the missed doses. On the right is another graphic, and I'll just take you only to 2021. 2021 in the Western Pacific region, in which includes Philippines and other countries, we have 1.4 million kids who were surveyed and did not, or they missed the MCV1, that's the first dose of measles vaccine. So 26 countries, the number in brackets here, which you see at the top, is always the countries which were surveyed. For example, in 2020, there were 26 countries only, and 800,000 kids had missed the MCV1 in Western Pacific. Whereas now, let's focus on the last bar, which is 2021. We had 1.4 million children who did not receive their first dose of measles vaccine in the 26 countries which were surveyed. But look at the coloring. You have Laos in blue, you have Malaysia in darker brown, but look at the yellow, Philippines. Philippines, out of the 1.4 million kids in Western Pacific in the 26 countries surveyed, 1.4 million kids missed their first dose. Philippines contributes almost 1.1 or 1.2 million of these. So again, we have started at a global level. We've looked at the Western Pacific as a region, and now we are zeroing in on Philippines and seeing that Philippines is a major contributor to the unvaccinated children if you use the DPT3, which I explained earlier, or the measles doses. So this is unfortunate and something that we would like to see that it is resolved to get back the Western Pacific to its targets, as well as to encourage Philippines to actually come up and reduce that gap. Next slide, please. Barriers to catching immunization, what are the barriers to catching up in immunization? We have seen the trend. There was some fall, which was worsened by the pandemic, which affected about 100 countries, but some countries were affected more. And we look at Western Pacific, we see that Philippines was particularly affected with 1.2 million kids who did not receive their measles first dose, out of the 1.4 in the Western Pacific in the 26 countries that were surveyed. So what are the barriers? We are struggling to reach the children. Some of them, they are not fully protected because we said there's need for 2 doses, but even some of them get only 1. Then outbreaks sometimes happen in healthcare setting. Why? People go to the hospital for some other reason and maybe get measles or in the hospital setting. Some groups are not included in the vaccination plans. We have seen, I'll give you an example. In Malaysia, Malaysia has very high coverage, but among the indigenous people. At the same time, Malaysia has very many migrants who are coming in for work. And in this, the coverage is very, very low. In fact, I'll just tell you something that Malaysia is sending a delegation of 6 people here to observe the campaign in May with the view of saying, how do you reach the usually unreached? Because among the indigenous people in Malaysia, coverage is high, but in the migrants who come in for work, coverage is very low, and they have transmission of measles. So sometimes some groups are excluded. Sometimes it is here you have what they call the GIDA. GIDA, I forget what it means, but you know. So these which are difficult to reach. And then we discussed that the pandemic made it harder to get vaccines, fear, focus, money, health workers being channeled elsewhere. And then we have seen sometimes there's a swing in healthcare from disease control to comprehensive primary health care. This I have seen in my experience. This swing happens every 5 years. One time people say, no, let's focus on disease control. After 5 years, say, no, let's focus on comprehensive primary health care. So the current trend is to focus on comprehensive primary health care, whereas there's a need to balance the two to contribute to health services. So this current swing in focus on comprehensive primary health care means that some money, resources are being removed from disease control initiatives into the general pool of primary health care. So what needs to happen? We need to have better ways to monitor these diseases. it is difficult to focus on something which you don't monitor. For example, we have made the monitoring to know that there are about 7,800 cases of cancer of the cervix in Philippines diagnosed every year, with about 4,000 deaths. But these are quiet. If you do not monitor such a thing, you assume that the problem does not exist. So we need better ways of monitoring. Then we need to improve our overall health systems. Yes, disease control, but primary health care, and the decentralization of services so that everybody is able to reach. Then I have told you that WHO has launched the catch-up for the year 2023. We can recognize that during the years 2020, 2021, 2022, we had difficulty of focus on the immunizations for the children in the routine immunization program because of the focus on COVID-19 response. So we need to catch up those doses, otherwise we are going to have outbreaks. And then we need to address vaccine hesitancy. This is a major issue. Vaccine hesitancy ranges in a spectrum from those who delay, those who refuse, and those sometimes don't understand and want to be reassured. And so we need to address this in order to convince the people so that we want to change the story. Instead of saying, mother, vaccinate your child, rather to, this is my child, please vaccinate him or her. We want to change the narrative so that there's a demand for immunization and vaccination rather than we going to the mothers. And certainly we need to keep funding the immunization programs. And if you don't invest, you cannot expect to reap benefits. Next, please. One thing that we have discussed and we need to highlight when you are talking to politicians is that immunization is so important. It is a high return on the investment. For example, if you invest in cardiovascular disease research, for every $1, the return is about 5. For public infrastructure like roads and bridges, for every $1 invested, the return is about 3. Now, for immunization, I've jumped some of the others, but for immunization, for every $1 invested, you have about 16 in return for prevention of diseases, stopping overwhelming of the health care system, as well as missed opportunity to work or inability to work because you are caring for the sick. So Philippines, for example, spends about $94 million per year in procurement of vaccines. You can easily argue with the president that 94 million times 16 is what you reap when you vaccinate the child. This is the broader overall global estimate. And actually in some countries, the return on the investment reaches up to $20 or even $40 per a single dollar invested in immunization. So immunization has got a very high return on the investment, and that's the reason why we need to invest in it. And we need to argue with the politicians at all the levels, from the Department of Health, from the president, from the regional CHD, the regional governors, down to the barangay local chief executives, and say you need to invest into it, not just money for buying vaccines, but also for cold chain to make sure that the vaccine is safe in a cold environment, to the operating budget, operational costs. Next slide, please. So to wind up, we have made progress, but a lot of work still continues. 8 countries in the Western Pacific have eliminated measles, but only two have eliminated rubella. And rubella can be a disease which can be very severe for the unborn pregnancy. Our challenge, we set out to eliminate measles as Western Pacific by 2012, but we have missed this target. We still need to catch up and get back on this target. And that is why we are launching the catch-up in 2023, but also an example, the campaign for measles and rubella next month, over May. So our commitment, we catch up on the missed vaccinations, and use strict criteria and evidence to confirm measles elimination in Western Pacific, including Philippines. And that is my last slide, I guess. Thank you very much.
Thank you, Doc Quezala, for explaining to us the current situation on children vaccination globally and in the Philippines. So Doc Quezala will be back later to join us in our Q&A portion. So as we all know, vaccines are indeed important not only to protect our children from getting sick, but as well as to protect our communities from disease outbreaks. We have with us today Dr. Carla Orozco, a health specialist from the United Nations Children's Fund, to tell us about the benefits of vaccination to children and the health systems. Good afternoon, Doc Carla.
Good afternoon, Nikki. Good afternoon, everyone. Thank you for having me here. So, magandang hapon po sa lahat. Today, allow me to talk about a topic that is really close to my heart, and that's vaccination, and specifically the benefits of vaccination to children and the overall health system. Next slide, please. As you all know, immunization is really one of humanity's greatest public health achievements. If you will look at the numbers on the slide, globally, it can save 4.4 million lives every year, and it can even rise up to 5.8 million children that save only if vaccination coverage is really high, and we also follow the different goals, vision, strategies, and activities in the Immunization Agenda 2030. And as you know po, and maybe for some of you, vaccines have ended and controlled deadly diseases in the past. So if you can click, it has actually eradicated smallpox in the 1980s. So we haven't seen smallpox in the face of the earth, no? I think even for some of us, we're not yet even born when smallpox was eradicated. And that's really because of the power and the importance of vaccination. Another is it has also almost eradicated or ended polio, but because of the challenges in other countries and the pandemic, we're still on the process of eradicating polio. But in the country, we have managed to control the polio outbreaks in 1993 and 2019. So again, the country is polio-free. But that is also because of the massive polio outbreak response that would include really polio vaccination in 2019 and would spill over in 2020 and 2021. Aside from that, in 2017, the country has also been certified as having eliminated maternal neonatal tetanus. So that's another achievement, and much of that is really attributed to vaccination, aside from other maternal newborn child health services as well that have contributed to that. Next slide, please. So what are the benefits of vaccination? So we look at the benefits of vaccination to children, then later we'll look at benefits of vaccination to communities, and as a whole, what are the benefits of vaccination to the country? So first we look at, benefits of vaccination to children. First is, of course, good health. It can prevent vaccine-preventable diseases. It can prevent disabilities. It can also prevent deaths. And that would mean longer lives for children. They grow up to be productive adults. Vaccination can also reduce secondary infections, because some of the diseases, especially like measles, that they can also cause a complication that can lead to death, like pneumonia, diarrhea, etc. And it can also prevent antibiotic resistance, because you don't need to be sick every time. The child did not be sick every time and take on antibiotics. It prevents that as well. And it also contributes to minimizing the impact of sickness to other members, because if a child or a family member is healthy, they are vaccinated, then they don't contract the disease, then they don't also pass it to other family members, especially to those that are immunocompromised or those that are still very young to be vaccinated. And it also contributes to improve intelligence, and improved educational attainment, because children are not absent from schools. They are healthy, they're healthier, and they can attend to schools and improve their educational attainment and become productive adults in the future. Next slide, please. So now, what are the benefits of vaccination to the community? So you've heard of protection through herd immunity. So if a certain community or village has a very high vaccination coverage, like 95% or higher, especially for measles, then it can also contribute to population immunity, meaning it provides also protection to newborns and those with weak immune systems. So even if a disease comes in the community like measles, but since majority of the population are vaccinated, then the disease will not really infect so many children and even adults. Because of that also, there will be more resources for those more sick in the community, because you don't need to be investing, or the local officials or the local government units will not be investing in vaccine preventable diseases, because most of the population in that community are vaccinated. And as I mentioned earlier, it can improve labor productivity, and they can also provide more opportunities for work in the future when they become adults. And also, vaccines promote gender equity and empowerment of women. Bakit? Because usually in a community, globally and even the Philippines, the mothers and older girls, they're often the primary caregivers. They are the ones who bring the children to the health centers for vaccination, and if the children also are sick. But if children are vaccinated, then we prevent childhood illnesses, and it also reduces the time that parents and caregivers have to take off work to care for sick children. So those are some of the benefits of vaccination to the community. Now we go to the benefits of vaccination. Next slide, please. Okay, to the country. So as I mentioned earlier, healthier children, they become healthier adults, they become, they contribute to increased economic productivity, and that would mean a more prosperous economy and country. It also contributes to increased social value of life, and because it also prevents deaths from vaccine preventable diseases. And as mentioned earlier by Dr. Quisala, it also delivers an return of investment for every dollar spent, as mentioned. So it as an average globally, it can deliver a return of investment of up to $26 for every $1 spent. So it really makes good economic sense if we invest on vaccination, and vaccination of the majority of the population that needs to be vaccinated. And also, healthier populace means less hospitalizations and less health expenditures. Next slide, please. So immunization not only benefits the child, the community, and the country, but it also benefits the whole health system, especially primary health care. Because why do we say this, and why do I say this? Because immunization is a well-established point of contact with children, families, and communities. And it is really an entry point for the delivery of other essential health services. It starts with immunization, but other essential health services, like for mothers, antenatal care, family planning, they can go hand in hand. And it also contributes to improvements in access, because once immunization services are there, then most probably other health services are also available, because there is investment from the local chief executives and also from other stakeholders supporting immunization. And the reverse is also true. So primary health care systems can also contribute to efforts to prevent the backsliding of vaccination coverage and reach those that are left behind. So a strong, a robust primary healthcare system can really also catch children that are perennially unvaccinated. But that would mean also getting the support of the local officials, the health workers, and other stakeholders, working together to provide those services. Next slide, please. So what are the consequences of failure to immunize a child? So we call this a looming child survival crisis. And it's actually happening even as we speak. It can really cause children's lives to be lost in the country. As you know, we had measles outbreaks in the past. We had thousands of measles cases and even deaths from measles. Aside from that, the consequences of failing to vaccinate may become even more severe in the years to come. We cite climate change risk, exposing communities to infectious diseases such as malaria, dengue, and cholera, and they may also alter seasonal disease patterns, which also puts further strain on children's access to essential services, including clean water and primary health care. And more importantly for UNICEF, a failure to immunize a child means the child will not reach their full potential. And it also undermines the right to what the Convention on the Rights of the Child describes as the enjoyment of the highest attainable standard of health and to facilities for treatment of illnesses and rehabilitation of health. Next slide, please. So as a consequence of children not being vaccinated, we have what we call the zero-dose children. Who are the zero-dose children? These are children that have not received a single dose of childhood vaccines. So this is very alarming, because in the Philippines, in 2021, we have like 1 million children that are zero dose, and we are the 5th country in the world in terms of the largest number of zero-dose children or unvaccinated children. And why are we alarmed by this? Because these children comprises the pool of susceptible that can have or a pool of susceptible for outbreaks of vaccine-preventable diseases like measles and polio, diphtheria, etc. Next slide, please. So what are zero-dose children like? Actually, zero-dose children, they are not only children that are not vaccinated. It's actually an indicator of children suffering from multiple deprivations, because most probably these are also children that are born from mothers without access to prenatal care when they were pregnant. Probably this or most of these children are born without a skilled birth attendant, meaning a doctor, a midwife, or a nurse. They are deprived of nutrition, including exclusive breastfeeding, and they grow up stunted. And these zero-dose children are also unable to attend primary school. So they really tell a story, a sad story, actually, of inequity, poverty, underserved communities, and unempowered women. So next slide, please. So this is my summary slide. Just to reiterate the importance of vaccination, it has saved millions of lives from deadly outbreaks of vaccine-preventable diseases, and it still is saving lives. Vaccines, they are safe, they are effective means that they not only protect children and their communities, but they also allow them to thrive and lead happy and productive lives. And they also contribute to a prosperous country and economy. Vaccination can be an entry point for other essential services, health services. And this integration can be a catalyst for improving the primary healthcare agenda and contributing to universal healthcare. But to achieve this, we must empower our health workers, our local officials, engage with other stakeholders to ensure efficient and equitable delivery of services and prioritize investments on immunization. And lastly, we talk about zero-dose children. They tell a sad story of inequity, poverty, and underserved communities and unempowered women. As I've mentioned, the Philippines has a lot of zero-dose children, 1 million. That's almost 50% of the annual birth cohort of children or annual children that are born annually in the country, and the 5th highest globally. So focusing on zero-dose children provides an opportunity to address other deprivations that they and the other members of their community face. That's all from my side. Thank you.
Ayan. So maraming salamat po, Doc Carla. In her presentation, we saw the numerous benefits of immunizing our children. And we do hope na sasapat na ito upang mahikayat kayo na pabakunahan ang inyong mga chikiting. And to explain to us the routine immunization for children in the Philippines, we have with us today none other than Dr. Anna Ong Lim, Chief of the Infectious and Tropical Disease Section of the Department of Pediatrics at the University of the Philippines, Manila, Philippine General Hospital. Good afternoon, Doc Anna.
Good afternoon, Nikki, at magandang hapon sa ating lahat. I know we're joined by so many of our parents, mothers, caregivers na talagang naniniwala or have a lot of confidence in the power of immunizations at gustong-gustong maintindihan ang mga detalye tungkol sa pagbabakuna ng kanilang mga anak. So for this part of the presentations, ang magiging focus ko ay yung mga routine immunizations na ibinibigay sa ating bansa. No? So I'm sure marami sa ating mga kababayang nakikinig ay kabisado itong chart na ito dahil nakikita ito sa ating mga tinatawag na baby book or vaccination record. So matagal na actually may programa ang ating gobyerno na magbigay ng mga bakuna sa lahat ng sanggol mula age 0 o yung bagong panganak hanggang makaabot sa 1 taong gulang, no? Meron tayong mga bakunang ibinibigay na ipinasok talaga natin sa programa kasi nakikita natin na itong mga sakit na ito ay dapat tutukan dahil sila ang tinatawag na may pinakamataas na burden of disease o di kaya pinaka-common, pinakamadalas na makita at sila din ang typically nagiging source ng pagkaka-ospital o di kaya pagkakadisgrasya ng bata. So makikita natin dito ang mga bakunang very familiar na sa atin, kasama na yung BCG o yung bakunang kontra sa tuberculosis, ang bakuna laban sa hepatitis B, yung 5-in-1 vaccine na tinatawag na siyang pangontra sa diphtheria, pertussis, tetanus, at H. influenza B, ang polio vaccine, ang pneumococcal conjugate vaccine o minsan natatawag tong pangontra sa pneumonia, at of course yung bakunang laban sa tigdas or measles rubella vaccine, no? So babalikan ko to maya-maya pero gusto ko lang muna ipakita bakit ba napili itong mga bakunang to? Saan ba nag-ugat itong programang vaccination na ginagamit natin or ating sinusunod sa Pilipinas? Alam niyo matagal nang established ang tinatawag na Expanded Program of Immunization. Marami sa ating mga nanay na nakikinig ngayon na may mga anak na maliliit, hindi pa siguro kayo pinapanganak, meron ng programang ganito. It was established in 1976 at nung simula, binibigyan tayo ng mga bakuna ng ibang mga global agencies kasama na ang UNICEF. At yung mga nabanggit kong bakuna ay siya pa rin naging target nung mga panahon na yon. So I want to emphasize this kasi makikita natin na itong mga bakunang ginagamit natin ay dekada ng experience, no? And nakikita natin na base doon ay napakaganda ng safety and efficacy record. So, nung mga panahon na yon, ang ating target ay siya pa rin mga target ngayon tulad ng TB, polio, measles, pati na rin yung sinasabing DPT or diphtheria, pertussis at tetanus. Before nung nagsimula at hanggang ngayon, ang pinaka sentro ng pagbabakuna yung ating mga local health centers or yung rural health units na staffed by our very conscientious public health staff na siya namang naniniguro na ang mga batang ipinanganganak sa nasasakop nilang lugar ay mabibigyan ng mga bakuna according to the recommended schedule. Ang habol talaga natin ay sana itong mga bakunang ito ay maibigay na bago pa umabot sa first birthday ng mga bata. So, liban doon sa mga nabanggit kong mga bakuna na nakikita dito sa first part ng ating diagram, nagkaroon din tayo ng pagkakataon na dagdagan pa yung mga bakunang kasakop ng Expanded Program on Immunization, yung tinatawag na ngayon as the National Immunization Program. So nung nagkapondo na tayo ng karagdagan para makabili ng sarili nating mga bakuna, mula na rin dun sa mga taxes na nakukuha natin sa mga alak at sigarilyo, nagkaroon tayo ng opportunities na magbigay ng bakuna laban sa pneumococcus, sa flu, sa tinatawag na cervical cancer na nakikita rin natin ay bigat ng burden of disease, meaning maraming mga tao na may ganitong klaseng mga sakit na alam naman natin kayang kalabanin ng bakuna. So babalikan ko itong mga sakit na ito para maipaliwanag siya ng mas malalim, no? Kung bakit ba ito yung mga napili natin. I'm sure marami sa atin very familiar, no, with measles. Kasi kung hindi tayo mismo ang nagkaroon ng sakit na ito, may mga kapatid tayo, kamag-anak o kaya kapitbahay na nakitaan na natin na nagkaroon ng tigdas. Karaniwan sa mga taong nagkakatigdas, kinakailangan lamang alagaan sa bahay, bibigyan lang ng gamot para sa lagnat, at akusa namang gumagaling. Pero hindi rin kakaunti ang mga nao-ospital, nagkakaroon ng komplikasyon tulad ng pulmonya, kumbulsyon o pagkabingi, at meron ding pangilan-ngilan na nadidisgrasya. So dahil meron naman tayong bakuna na napakabisa laban dito sa sakit na ito, isa ito sa talagang tina-target ng global vaccination programs dahil napakabilis niyang kumalat at napakaraming nahahawaan. Kung naaalala pa natin noong 2019 and even noong 2018 bago pumasok ang pandemya, actually nagkaroon tayo ng measles outbreak. Marami sa ating mga kababayan ang naapektuhan nito. And in fact, may ibang mga outbreak sa ibang mga bansa na nanggaling sa travelers, na nanggaling sa Pilipinas. So hindi lang natin ikinalat sa ating bansa, ng export pa tayo, no, sa ibang mga bansa sa US at sa Europa. So lubhang nakakahawa, maraming napeperwisyo, may bakunang mabisa at very affordable, kaya kasama talaga siya sa mga programa ng maraming bansa. Kasunod dito yung polio. Ito hindi na gaanong nakikita ngayon, no, sa mundo, and in fact, may target na nga tayong magkaroon ng elimination or eradication ng polio globally. Katulad na lang ng nasabi ni Dr. Carla kanina tungkol sa smallpox, hindi na nga natin kilala yung sakit na yan. So ang hinahabol natin, sana sumunod na ang measles at polio, na sana wala nang magkaroon pa at mahawa sa mga sakit na ito. Napakasimple ng pagbibigay ng bakunang ito. Ito yung ating mga ipinapatak sa mga sanggol, no? And lately, dahil nakita natin na may karagdagang bisa ang pagtuturok laban sa polio, ay sinasama na rin natin to sa ating mga programa. So dito sa calendar na ito, makikita nating may oral polio at inactivated polio vaccine. Nakikita natin na ang pinakamatinding epekto ng polio ay yung pagkalumpo, no? And actually, hindi lang natin siguro napapansin, pero madali itong kumalat at madali ring makahawa sa mga tao. Actually, pwedeng mailipat, no, sa mga sa tubig na hindi malinis, no. So kung infected ang ating water sources, pwedeng kumalat sa paraan 'yon. Ang hepatitis B ay isa ring problema sa Pilipinas. Marami pa rin tayong mga kababayan na nagkakaroon ng cancer sa atay, o di kaya yung sinasabing liver cirrhosis or matinding sakit sa atay na nararamdaman pag tayo umaabot na sa adulthood, no? Hindi karaniwang nakikita ito sa bata, pero pagka tayo nagiging adult, pwedeng doon pa lumalabas ang epekto ng pagkakahawa ng hepatitis B during infancy. So again, dahil merong ang effective and safe vaccine na very affordable, kasama din ito sa ating mga programa. Hindi na natin gaanong kailangan pang ipaliwanag ang TB kasi mukhang kilalang-kilala na natin ito. And meron tayong bakuna, ang BCG, na ibinibigay sa mga bagong panganak na sanggol na nakakatulong na makaiwas sa mga complicated forms ng TB. And finally, meron tayong mas bagong bakuna, yung tinatawag ng pneumococcal conjugate vaccine. Katunog niya yung pneumonia. And in fact, isa sa mga sakit na pwedeng kontrahin ng pneumococcal conjugate vaccine ng pneumonia. Pero liban doon, meron pang mga infection sa utak o kaya infection na kumakalat sa dugo na dala rin ng pneumococcus na pwedeng mapawi pag naturo ka ng pneumococcal conjugate vaccine. So dito makikita natin na kung makasunod sana ang isang sanggol sa naaayon na schedule, malaking ginhawa ang mararamdaman niya kasi makakaiwas sa napakaraming sakit, no? Magiging abot kaya or maaabot, no, ang very healthy and safe childhood, makakaiwas sa napakaraming sakit. And of course, alam naman natin ang bigat ng gastusin ng mga pagpapa-ospital, no, or pagkakaroon ng sakit na siya naman ding tulong sa pamilya, no, na maiwasan itong mga problemang ito. So, bakit ba nandiyan ang focus natin and pinag-uusapan natin itong mga routine immunization sa ating bansa? Alam ninyo, tayo ay pinagdiriwang natin ngayon ang World Immunization Week, no? Ito ay taunang selebrasyon na pinamumunuan ng World Health Organization. 2012 nung unang idinaos ang World Immunization Week. At naisip ng ating mga global health agencies na kailangan magkaroon ng ibayong pagtutok dun sa usapin ng immunization kasi malaking problema itong pagkalat ng vaccine-preventable diseases sa iba't ibang bansa sa mundo. Nabanggit kanina na ang Pilipinas ay isa sa mga bansang pinakamarami ang mga batang hindi kompleto o hindi man lamang nabakunahan. So makikita natin dito sa pinapakita kong slide kung gaano lamang ang nasasakop ng na porsyento ng mga batang nabakunahan sa Pilipinas. So kung titignan natin itong mga numerong ito, wala ni isa na umabot sa 60%, no? So only 47% ang nabakunahan ng BCG. Only 57% ang nakakompleto ng 3 dosis ng hepatitis B. Mas kaunti pa ang nabibigyan ng birth dose or pangunang dosis ng hepatitis B, 39% lamang. Wala pa sa 60% ang nakakakumpleto ng mga 5-in-1 vaccines at ganoon din sa ating mga polio vaccines. So, ito ay talagang napakalaking problema kasi alam niyo kung iisipin natin, syempre ang gusto natin masakop ang karamihan ng mga bata para mabigyan natin sila ng sapat na proteksyon. Alam niyo ba kung ano ang dapat nating target? Actually, kailangan nating maabot ang tinatawag na 90% target na nakikita natin dito sa graph na ito. So, para maabot natin or mapigilan natin ang pagkalat ng sakit, actually, dapat 95% sana ng isang population ang mababakunahan. And yet, wala man lang tayo dun sa 90% at hindi man lang tayo umabot dun sa 60% na nababanggit ko kanina. So, actually, kabilang na naman tayo. So, first honor na naman tayo sa mga infectious diseases, no? In 2020, there were about 17 million children worldwide who were incompletely vaccinated against diphtheria, tetanus, and pertussis. And around 65% of these children live in 10 countries. Kabilang na tayo sa Pilipinas. So sana, no, dito sa panahong idinaraos natin ng World Immunization Week, share natin itong kaalamang ito, no? Sana magkaroon tayo ng iba yung consciousness, iba yung pagpapahalaga, no? Dun sa value of vaccination and maintindihan natin na ito ay abot kaya at very important na intervention para mabigyan ng sapat na proteksyon ang kabataan. So, hindi naman natin sinasabing problema lang natin ito, no? Nagkaroon talaga ng malaking impact ang COVID pandemic dun sa immunization coverage because global coverage dropped across many countries. Pero sana, no, ngayong palabas na tayo or patapos na ang pandemya, magkaroon pa rin tayo ng pagtutok, no, dun sa mga sakit na hindi naman nawala dahil nagkaroon ng pandemic. In fact, ngayon na nagtitipon-tipon na naman tayo lahat, lalo siguro nating pag-ingatan yung pagkalat nitong mga sakit na to, lalo dun sa mga tinatawag nating vulnerable populations, kabilang na ang mga bata. So with that, I hope I've been able to emphasize once again the need for compliance with routine immunizations in our country para mabigyan natin ng magandang kinabukasan ang kabataan sa Pilipinas. Maraming salamat po.
Ayan. So maraming salamat po, Doc Ana. So maliban sa bakuna kontra measles, rubella at polio, binigyang diin din ni Doc Ana ang kahalagahan ng ibang mga bakuna laban sa ibang mga sakit. Gayon din ang pagtalakay sa tamang panahon at intervals ng pagbabakuna nito upang masiguro natin ang kaligtasan ng ating mga chikiting. So kahapon, bilang kalulunsad lamang po natin ang Chikiting Ligtas sa lungsod ng San Juan, narito po si Dr. Janice Bunoan Macazo, Medical Officer 4 ng National Immunization Focal ng Disease Prevention and Control Bureau ng Department of Health upang ibahagi naman sa atin ang on-ground vaccination efforts and programs ng Department of Health. So magandang hapon po, Doc Janice.
Hello po, magandang hapon po sa inyong lahat. Magandang hapon, Nikki, and good afternoon po to all our guests. So naatasan po ako na magsalita tungkol sa ating mga programa sa National Immunization. So halos nasabi na po lahat ni Doc Ana. So parang wala na po akong sasabihin. Pero joke lang po. So ito po yung mga programa na meron tayo sa ating sa Department of Health. Next slide po. So yun, nabanggit na rin po ni Dr. Ana, so ang National Immunization Program natin ay nagsimula pa po noong 1976, hindi pa po ako buhay. Matagal na 40 years old na po halos ang ating National Immunization Program. Nagsimula po ito na 6 na bakuna, pero ngayon 14 na bakuna na po ang binibigay natin. So ngayon, hindi lang po tayo sa pangbata, meron din tayong pangmatanda. Sige po, next slide po please. So ang ating immunization program, hindi lang po nga pangbata dahil po sa Universal Healthcare Law, ang ating programa po ay in-expand natin from pregnancy hanggang sa pagtanda. So marami po tayong binibigay na bakuna at lahat po ito ay libre. So ang mga binibigay po natin, so bukod po dun sa ating nakikita na bakuna card na para sa mga baby, nag-expand na po tayo, marami na tayong binibigay. So ano po yung mga binibigay natin? So sisimulan ko sa habang buntis pa lang yung nanay. So nagsisimula po ang lahat habang nasa loob pa lang ang baby sa tiyan ng mami. Nagbibigay na tayo ng protection para sa kay baby para hindi siya magkasakit paglabas niya. So sa pagbuntis po, ang binibigay po natin ay tetanus, diphtheria. So para po maiwasan po natin ang neonatal tetanus paglabas ng baby. At paglabas naman niya, binibigyan na natin siya ng BCG. Ito yung panlaban sa TB. Binibigyan na rin natin siya ng first dose ng hepatitis B. Pagkatapos naman po, pagka 1.5 months niya, so dito na tayo nagsisimula, yung kung nakikita nyo sa bakuna card. So yung oral polio vaccine, yung pentavalent vaccine o yung 5-in-1, yung pneumococcal vaccine, pneumococcal conjugate vaccine, at pagdating naman yan ng 9 months at 1-year-old, binibigyan na natin siya ng measles, mumps at rubella. Pagkatapos naman nun, hindi pa natatapos yon. So pagdating po ng 1-year-old ni baby, hindi po natatapos ang bakunahan natin. So dapat magbalik pa rin po kayo sa ating health center kasi meron pa po siya pag medyo mas malaki na siya. Sa childhood naman po, pagdating po niya ng grade 1, nagbibigay rin po tayo ng measles containing vaccine, pwede pong MMR. Kasabay po, nagbibigay rin tayo ng tetanus, diphtheria, tetanus diphtheria vaccine. So ito po ay mga booster dose. Bakit tayo nagbibigay ng booster dose? Kasi po, meron mga bakuna na pagdating ng ilang taon, medyo bumababa na yung protection natin. Kaya dapat nagbo-booster po tayo. So hindi natatapos ang ating mga booster sa childhood o sa grade school. Siyempre, pagdating po ng grade 4 ng mga bata, meron na naman po silang mga bakuna na nakukuha at libre rin po ito. Yung pong ating human papillomavirus vaccine ay binibigay rin natin sa mga selected na mga areas para sa mga grade 4 students, yung mga 9 to 14 years old. Tapos hindi pa po nagtatapos, meron pa rin po. Hindi tayo tumitigil doon sa pagprotekta natin ng mga Pilipino. So meron pa rin pong pagdating po ng grade 7, nagbibigay naman tayo ng isa pang booster ng measles, ng pwede pong MMR or MR, at nagbibigay ulit tayo ng tetanus, diphtheria. So pagdating po ng adolescents pa lang, hinahanda na po natin ang mga bata para sa kanilang adulthood. So pagdating naman ng adulthood at ng elderly stage, sa ating mga senior citizen naman po, ang binibigay naman po natin para sa mga piling senior citizen, nagbibigay naman po tayo ng libre na flu vaccine at nagbibigay rin tayo ng pneumococcal vaccine panlaban nila sa mga sakit ng pulmonya at saka ng flu. So ito po ang mga bakuna natin, hindi lang nagtatapos sa pagkabata hanggang po simula sa pagkabuntis hanggang sa pagtanda, meron po tayong binibigay na bakuna. So protection po natin ng vaccine preventable diseases across life stages. So ano pa yung mga inaasahan natin na maibibigay ng National Immunization Program sa mga susunod na taon? So pwede mag-e-expand na rin po tayo. Ang mga plano po natin, i-expand na po natin ang human papillomavirus vaccine nationwide na. Hindi na lang ito sa selected areas. Pati yung mga pneumococcal vaccine, pinag-aaralan na po kung pwede natin itong bigay sa lahat na ng senior citizens. Sa ngayon po kasi, yung mga indigent senior citizens pa lang yung binibigyan natin. In the future, kapag meron na rin pong mga polisiya at meron ng go signal ng ating Health Technology Assessment Council, pwede na rin po, depende sa nakalagay sa ating Omnibus Health Guidelines, maari na rin po tayo, tinitingnan na rin po natin kung pwede na rin nating idagdag sa National Immunization Program ang mga bakuna para sa dengue, malaria at TB. Next slide po. So ano nga ba po yung ating COVID, yung target natin? Ang national target natin ay 95% immunization coverage or 95% of fully immunized child. Kada taon, ang target natin na mabakunahan ay nasa 2 milyong bata. So imagine niyo po yun, halos 2 milyon ay dapat mabakunahan natin. Bakit natin gusto 95%? Bakit hindi 50% lang? Bakit hindi 70% lang or 75% para po pasang-awa? Bakit hindi ganon? So ayon sa mga eksperto, ang kailangan natin ay maka-achieve tayo ng 95% coverage o kaya 95 kada 100 na tao dapat mabakunahan. Kasi doon lang natin ma-achieve ang yung tinatawag nila na herd immunity. Ano nga ba yung herd immunity? So ang bakuna po hindi lang para sa individual, para rin sa community, para rin sa mga mahal natin sa buhay, para sa mga kapitbahay, sa mga buong community, kaya tayo nagbabakuna. So sabi natin, di ba, universal healthcare at dapat lahat ng tao ay nabibigyan ng bakuna at lahat na po protektahan. So bakit nga ba? Ano ba yung herd immunity na tina-target natin? So pwede po natin ihalin tulad dito sa picture na ito. So nakita niyo po, merong nakahawak ng mga umbrella. So yung naka-blue po na umbrella, yun yung mga nabakunahan na. At yung nakahawak naman ng umbrella na walang takip, yun yung mga hindi pa nababakunahan. So kapag yung mga kulay blue na umbrella, yun yung mga nabakunahan na, yung mga naka-red, pwede po yung mga batang masyado pang bata para mabakunahan. Kagaya ng kunyari sa tigdas, ang mga pwede pong bakunahan ng tigdas ay yung 9 months old pataas. Pagka less than 9 months po, hindi pa sila bakunado. So, pinoprotektahan natin yan. Yung mga may cancer, yung bumababa yung kanilang immune system, tinutulungan natin yan, pinoprotektahan natin yan. Yung pong mga may sakit sa immune system nila na hindi sila pwedeng makakuha ng vaccine, so pinoprotektahan din po natin yung mga yan. Kaya yung 5% na nire-represent ng mga tao na hindi pa pwedeng mabakunahan or hindi pwedeng mabakunahan dahil sa mga ibang sakit, so yun po yung pinoprotektahan ng 95%. So nasabi po yan ni Dr. Carla kanina, kailangan maprotektahan natin at maraming benepisyo yung pagkakaroon ng 95% na fully immunized child or yung coverage natin. Pero ano nga ba yung kailangan nating makuha para masabi natin na 95% tayo? So ang dapat lang na makuha, isang dose ng BCG sa pagkapanganak, 3 DPT o yung 5-in-1, 3 dose ng oral polio vaccine at 2 dose ng measles-containing vaccine o yung MMR. So yun lang yung kailangan minimum. Hindi naman natin sinasabi na ito lang dapat yung makuha mo pero ito yung mga minimum. Pwede mo pang dagdagan. Marami pa tayong mga booster. Pero ito yung mga kailangan natin para masabi natin na meron tayong 95% na fully immunized child at ito dapat nakuha na po nila ito simula nung nag-1-year-old sila, dapat nakuha na nila ito para masabi natin na na-achieve na natin yung target natin na 95%. So unfortunately po, sa nakita natin sa report ni Dr. Quezala, hindi pa natin siya na-achieve. Sa sa report din ni Dr. Ana, hindi pa po natin siya na-achieve. Medyo matagal na natin na hindi siya kukuha at medyo lumalayo na rin tayo, palayo tayo ng palayo dun sa target natin. Kaya kailangan talaga natin magtulong-tulungan para umabot tayo dun sa 95% na target natin. So, next slide po. So yan. So ano na nga ba yung ginagawa natin sa National Immunization Program? So syempre po, una sa lahat, tuloy-tuloy pa rin po ang ating serbisyo. Nagbibigay po tayo ng libre at dekalidad at effective na bakuna sa lahat ng health centers at barangay centers. Lahat po yan ay libre. Wala po kayong babayaran, kundi pumunta lang po kayo doon at para magpabakuna. So, yan. So, yan po. Kung hindi po natin na-achieve ang 95% immunization coverage, ang ating mga health workers po sa baba ay gumagawa ng catch-up immunization. Taon-taon po nagkakaroon tayo ng review kung gaano kataas ang ating coverage. Kapag hindi po tayo umaabot ay nagka-catch up immunization po ang ating mga health workers sa ground. Pumupunta po sila pwedeng every purok, every barangay. So reaching every purok and reaching every barangay ay ginagawa po nila yan sa ground para mahanap po nila, masuyod nila kung ilan yung kung sino-sino ba yung mga wala pang bakuna. At ngayon naman, dahil nga meron po tayong impending, tayo po ay high risk na naman sa measles dahil hindi na naman po tayo nakakuha ng 95%, medyo mababa lang, ilang taon na. So ngayong taon ay magsasagawa po tayo ng measles, rubella, OPV, supplemental immunization activity at mangyayari po iyon. Next week na po, mag-start na po tayo. From May 1 hanggang May 31, nationwide po ito. Lahat ng bata, 0 to 59 years old, ay target na mabigyan ng oral polio vaccine at ang 9 months hanggang 59 months ay target naman po na mabigyan ng measles rubella vaccine. So, dapat po ay wag po kayong matakot at kunin niyo pa rin po yung mga bakuna. Kahit na meron na silang bakuna noon, ay magpabakuna pa rin kasi wala naman pong overdose. At isa pa is ito, dagdag na protection. Parang booster na po ito ng mga bata kahit na meron na silang mga bakuna noon. Pero mas maganda, kung wala pa silang bakuna, mas maganda dahil magkakaroon na sila ngayon ng bakuna. So bukod pa doon, bukod sa bakunahan, syempre hindi po mawawala ang ating advocacy campaigns and social behavioral change sa community. So bukod po sa mga flyers, mga tarpaulins, social media na doon po tayo nagbibigay ng advocacy, syempre po bumababa din po tayo, gagawa po tayo ng social behavioral change design sa community po. Yon, hindi lang siya basta-basta na magbibigay ng lecture, kundi inaalam talaga sa baba kung ano yung mga dahilan bakit hindi nagpapabakuna. At ito po ay kasama po natin ang Health Promotion Bureau sa paggawa ng mga ganitong activities. Sa sunod po dyan, tinatry po natin na increase ang access to service delivery and supply. So isa po sa mga naging problema noon ay sometimes nawawalan ng bakuna kaya hindi nababakunahan o kaya during pandemic nagiging busy po ang ating mga health workers dahil pinaprioritize ang COVID-19. So ngayon po, dahil bumabalik na po tayo sa new normal or sa normal, syempre gusto po natin na increase yung access natin sa bakuna. So ngayon po, meron na po tayong mga polisiya na ang Wednesday ay National Vaccination Day. So dapat po 7 to 4 meron pong nagbabakuna. Okay? Kung wala naman, pero hindi ibig sabihin po na Wednesday lang ang pwedeng magpabakuna. Anytime naman po, pwede pa rin kayong pumunta. Basta't kailangan ng bakuna, pwede pa rin mabigyan. Tapos po, syempre noon ay hirapan tayo sa ating cold chain storage. Pero isang magandang blessing na nagkaroon ng pandemic dahil nag-increase yung ating cold chain storage. At inaayos na rin po natin yan sa tulong ng ating mga partners sa UNICEF ay inaayos na rin po yung ating cold chain storage. And syempre po, bukod doon, meron din po tayong active surveillance and monitoring. Kasama po natin ang Epidemiology Bureau at ang Knowledge Management and Information Technology Service, mga departments, mga bureau po dito sa DOH. Sila po ang tumutulong sa atin na i-train ang lahat ng mga surveillance units sa LGU level, provincial level. So ngayon po meron na rin po silang mga ginagawang mga innovation para maging electronic na ang ating mga surveillance. So halos kumpleto na rin yung electronic surveillance recording nila para mas madali nating malaman kung meron bang mga kaso kagaya ng tigdas, kagaya ng polio, kung merong mga kahina-hinalang kaso ay agad na magagawa natin ng paraan para hindi na siya dadami, hindi na dadami yung kaso, maka-respond tayo agad. Kasi meron tayong active surveillance and monitoring. At meron din po tayo na magkakaroon na rin ng electronic medical record na kung saan makikita natin na mas mabilis or mas maaga yung mga pagbabakuna. So sana sana ay magiging real time na yung pagtingin natin dun sa coverage natin. So hindi na natin kailangan maghintay ng 1 taon para makita natin yung overall picture. At syempre, meron din po tayong active communication with partners and implementers. So marami po tayong mga kaibigan, kagaya po ng WHO, ng World Health Organization, ng UNICEF, USAID. Marami rin po tayong local partners. At syempre po yung mga medical society natin, meron po tayong active communication with them para po matulungan nila tayo. So hindi lang po Department of Health ang kumikilos para sa National Immunization Program, pero ito ay whole of society, whole of nation approach. Lahat po tulong-tulong na gumagawa ng paraan para po tayo ay maprotektahan sa pagbabakuna. So yun po. Next slide po. Sa tingin ko, ito na yung huli. So this year, we must urgently catch up, restore, and strengthen routine immunization. So ngayon po ang time para mag-catch up tayo. Pumunta po tayo sa pinakamalapit na health center para magkaroon tayo ng impormasyon tungkol sa mga immunization. Kung meron pang mga tanong bukod sa mga naipresenta ngayon, pwede po kayong pumunta sa inyong health center at tanungin ang inyong mga health worker para mabigyan kayo ng informed choices at mas madali ninyong maintindihan bakit po tayo nagbabakuna. So yun lang po. Maraming salamat po.
Ayan. So maraming salamat po, Doc Janice. Kaya naman po muli, inaanyayahan po namin ang ating mga magulang at legal guardians na dalhin ng kanilang mga anak sa bakunahan para makilahok sa ating Chikiting Ligtas, join the big catch-up. Ayan, so dahil napakasiksik na rin po ng ating naging discussion para sa araw na ito, medyo kukonti na lamang din po ang ating oras, kukonting tanong na lamang din po ang ating matatanong para sa ating mga speakers. So muli, we are calling on Doc Quezala, Doc Carla, Doc Ana, and Doc Janice to join us sa atin pong Q&A for today. So for our first question to be answered by Doc Quezala and Doc Carla and Doc Ana, since according to the UNICEF, vaccine confidence in the Philippines declined due to the COVID-19. What are the steps that we can recommend to the government to combat the growing vaccine hesitancy in the country? So again, this is for Doc Quezala, Doc Carla, and Doc Ana to answer po. Doc Quezala can answer first, and then Doc Carla, and then Doc Ana po.
Sorry, I didn't realize, apologies, that my camera was off. Apparently, there's a switch to switch it on and off. Apologies. And could you repeat the question?
Oh, sure, Doc. Since according to the UNICEF, vaccine confidence in the Philippines declined due to COVID-19, what are the steps that we can recommend to the government to combat the growing vaccine hesitancy in the country?
Yeah, thank you very much. Vaccine hesitancy is a very complex issue, which is a spectrum from concern, delay, refuse, or even totally refuse. And all of these tend to have different. Sometimes even people refuse the givers of the vaccine and not the vaccine. So when you look at that in that spectrum, it becomes slightly easier when you define it just as a vaccine confidence or refusal. It becomes a bit complex to decide what to do. But the moment one accepts that it has this spectrum where some people, they have concerns, but they would like to be explained. They have questions, and the questions might be genuine. Others might have challenges with the health worker who is delivering the vaccine. So you need to assure them or to provide the health workers who are acceptable to them. The others, they have questions which, if you answer their questions, you can allay the fears or give them information which makes them get to a decision. And then they are the hardcore, but the hardcore tend to be very few. In my experience, they tend to be around 5 to less than 5%. And those are very tough. I cannot tell you that that's easy. And those actually, fun enough, usually they have some information. Whereas some who are hesitant a bit may not have enough information. These usually have information. I talked to somebody and said, maybe vaccines convert people into zombies. And I said, okay, we have vaccinated about 73 million Filipinos with COVID in the last 2 years. Did you ever meet a zombie walking on the streets of Manila? And he said, maybe they walk at night when you are not there. So, and we need to first focus on the low-hanging fruits. Those people whose concerns can be allayed, those who have questions, those who might be having questions about the deliverers, the health workers, those who are confused by social media, and they are even, I have found hesitants who are willing to be vaccinated at night when nobody can see that you are vaccinating them, so that they can continue presenting a face that we don't want vaccines, but they accept them in the night when you are not there. And I have vaccinated some religious sect in Zimbabwe who are willing to be vaccinated as long as we come at night. And why should I negotiate to vaccinate them during the day? I find a way to vaccinate them at night. So it's a complex issue, but at the same time, it is not monolithic. It's not one thing. It is small things which can be broken up into pieces, and using communication, giving good quality, giving good vaccinators, and discussing with the people correct information and asking them to get information from the correct places, like their health worker providers. I can give you another example. In Europe, they tried to vaccinate against swine flu in 2010. I think it was 2010. They put the vaccines in France with the pharmacy. The people refused. They said, no, my physician must talk to me first and tell me what I want. So it's not only in these societies. So there it is. Voila, I have said a lot. Thank you very much.
Thank you for that, Doc Quezala. Doc Carla, would you like to add something po to what Doc Quezala said?
Okay, thank you, Nikki. So it's a good question, no? So ano ba yung what would be our recommendation as UNICEF to combat vaccine hesitancy? So siguro before we can address it, kailangan we have to dig deep first, no? Investigate on the causes of vaccine hesitancy. Kasi ito ba ay because of cultural issues? Is it religious issues? Or meron bang lingering na rumor or misinformation dun sa community or sa isang province? Or aside from those reasons, is it an issue of malayo kasi yung health center? Medyo gusto naman sana nila magpabakuna, ang layo naman ng health center. So they're hesitant to go there to have their children vaccinated. So it can also be an issue of access and baka poverty, no? Wala silang pamasahe and all. So that's the first step that I would recommend. Second is support, no? Or the DOH can support planning based on kung ano yung reasons, no? Kung ano yung situation ng community or ng isang lugar. Why are they hesitant to have their children vaccinated? You can even do, we did this, nagkaroon kami ng qualitative research on knowledge, attitude, practices, no, sa isang urban poor community. So that can also be a good evidence to support planning, no, for interventions and implementation ng mga tinatawag natin context-specific na mga demand generation activities, awareness raising activities, and community engagement strategies. Kasi napaka-importante that we really engage with the communities kung ano man yung pinaplano ng ating gobyerno, and also always involve partners, no, when we do this. So yung another one is importante din kasi 'di ba yung mga mothers and caregivers, usually ang kausap nila, ang contact nila ay mga health workers, no, or BHW. So it can be midwives, nurses, doctors, or BHW. So we also have to train or i-train natin sila, na i-capacitate natin ang ating mga health workers, community volunteers on, meron kasi kaming sinupport din na training for them. Ito yung tinatawag na risk communication, community engagement, or pwede rin na parang interpersonal communication on immunization. Mga simple lang tong training na tinuturuan sila on how to address, una ibibigay yung right information to them and how to address rumors, misinformation. No? So it's a good, it's another good strategy. And as I mentioned earlier, no, and ginawa natin ito kahapon when we launch, and ginagawa natin ito lagi. We engage other partners kasi sila din, from all sectors, no, of the society. Kasi sila din, baka meron din silang pwedeng maitulong, no, in increasing the awareness and putting that right information across kung saan man sila, kung ano man yung work nila, kung saan silang communities, or kung ano yung kanilang scope of work, kumbaga. And we can also mobilize, of course, local leaders, na very important to address vaccine hesitancy kasi sila din yung mga influencer sa community, nakikinig ang mga tao sa kanila. We have to also provide them with the right information para sila mismo din ay convinced, and they can also convince their constituents. And we can also mobilize immunization champions. So it can be at the high level, pwede siyang regional level lang, pwedeng asawa ni mayor, asawa ni governor, pwedeng artista kung merong ganon. So we can also mobilize them to have the face as a champion na naniniwala sa pagbabakuna. Lalo na kung itong champion na ito ay isang nanay, no, na meron din siyang anak na kailangang bakunahan. And lastly, kasi nga sabi ko, yung vaccine hesitancy naman, hindi lang because of the misinformation and rumors, but also because of the problem ng access. So kailangan din, pagtulong-tulungan natin, no, as government and partners to improve access. So that would mean investing in human resources, additional human resources, lalo na dun sa mga malalayo. And even in the urban poor communities, it's also surprising na minsan kulang din yung access nila, kulang din yung kanilang mga magbabakuna. So kulang yung immunization sessions. So increase human resource, increase immunization sessions, and increase outreaches. So yun po, that's from my side. Over to you. Thank you.
Thank you for that, Doc Carla. Doc Ana, would you like to add something po sa sinabi ni Doc Quezala and Doc Carla?
Matunog parati ang usapin ng vaccine acceptance or vaccine hesitancy. Pero gusto ko lang suportahan yung sinabi ni Doc Carla kanina na hindi naman lahat ng pagkakataon dahil may pagdududa ang mga magulang tungkol dun sa bakunang ibinibigay natin at nag-aalala sila kung ligtas ba yan o mabisa. In many instances, ang problema natin ay hindi yung acceptance ng bakuna o hindi yung access. Meaning, may panahon ba yung mga magulang o yung caregivers na dali ng bata sa local health center? Pagka ba sila nagpunta ron, maaasahan ba nila na nandoon yung supply o meron staff na pwedeng umasikaso sa kanila? Aabutin ba sila na maghapon sa paghihintay? Sinong mag-aalaga ng kanilang 5 pang anak na iniwan sa bahay? O kaya paano sila sasakay para pumunta dun sa health center na medyo malayo-layo din sa kung saan sila nakatira? So all of these considerations are very relevant to our setting. And I think before we end up with the conclusion na wala na akong magawa kasi ayaw talaga nilang tanggapin, siguro dapat siguraduhin natin bilang isang sistema at proseso na yung mga problems na pwede natin bigyan ng solusyon ay naaasikaso natin. And then, at the same time, dagdagan natin ng iba yung pang educational campaign at pagpupursige dun sa pagpapakita ng ating magandang intensyon sa mga pamilya kasi nandoon din yung issue ng trust. Pagka may tiwala ang ating mga communities sa ating service providers, hindi mahirap tanggapin ang mga bakunang inaalok natin para sa proteksyon ng kanilang mga anak.
Ayan, so maraming salamat po Doc Quezala, Doc Carla, and Doc Ana sa inyong mga rekomendasyon on how to increase vaccine confidence in our country. And asahan naman po ninyo na ang kagawaran ng kalusugan through a whole of a government and whole of society approach ay gagawin ng aming makakaya upang ilapit ang mga bakuna sa ating mga komunidad. So para naman po sa ating susunod na tanong, Why do we say that children are the most vulnerable if ever there will be an outbreak of measles, rubella, and or polio? This question po ay for Doc Janice and Doc Ana to answer.
Sige. Kasi masasabi niya ni Doc Ana lahat, kaya mauna na po ako magsabi. um, ang mga bata po ay syempre sila yung mga most vulnerable. Number one, syempre yung immune system nila hindi kasing mature kesa ng mga adults. At syempre number two, syempre yung mga bata hindi pa sila nagsasalita. Hindi lahat nagsasalita. Yung lalo na yung mga less than 9 months old. So hindi natin alam kung ano yung mga nararamdaman nila. Sila talaga yung mga most vulnerable. So syempre less exposure din sa mga antigens kaya sila pa rin yung vulnerable kaysa sa mga adults. Pero hindi ibig sabihin nun na hindi magkakaroon ng sakit ang mga adults. Nagkakaroon din sila ng sakit. Hindi lang mas ganun kadami. Pero yun, nagkakaroon din ng sakit.
Ayan. Maraming salamat po, Doc Janice. Doc Ana?
At in addition to what Dr. Janice mentioned, which focused on yung capacity ng immune system ng mga kabataan na kalabanin ng sakit. Siguro naintindihan din naman natin na ang mga bata, pagka kinapitan ng sakit, dahil dun sa kahinaan din, relatively less able to resist illness, ang mga bata dahil sa kahinaan ng kanilang mga katawan. So, kaya ganun na lang ang ating pag-aalaga dito sa population na ito. Kasama na rin dun sa ibang mga tinatawag nating vulnerables tulad ng mga may edad o may iba pang mga sakit. So, ang pinaka-common denominator dito is yung lakas ng kanilang katawan kung makapitan, maaring madaling matalo. Kaya gusto natin silang mabigyan ng karagdagang proteksyon.
Ayan. So maraming salamat Doc Janice and Doc Ana for explaining that. So talagang mas kinakailangan talaga nating pabakunahan ng ating mga chikiting dahil sila nga yung mas vulnerable sa mga sakit kagaya ng measles, rubella at ng polio. For our next question naman po, what does improving the MROPV coverage mean at a global level? How important is our vaccination campaign from a public health perspective? This question is for Doc Quezala and Doc Carla to answer po.
Thanks. If I understand very well, everybody says that now the world is a global village. I recall in 2012, there were cases of measles in the US which had been almost eliminated. There were almost none. And the majority of the importations were from Japan. And the reason why Japan was having so many cases because it was giving a single dose of measles, and whereas 2 doses is better. So we had a lot of discussions and negotiations with Japan to start a 2-dose schedule. And since they started a 2-dose schedule, importations into the US became very low. And now actually the biggest importations are from Philippines. So that is where, because of increased travel, increased communication, and because we used to say measles somewhere is measles everywhere. You saw how COVID, I don't know where it started, but rapidly it spread all over. And similarly, you have seen sometimes cases of polio. For example, now polio, the wild polio is now remaining endemic in 2 countries. Philippines, no, not Philippines, no. Afghanistan and Pakistan. Sorry, I just automatically. So if you have this communication, it is possible for diseases to cross borders because they don't need passports. And then in the end, you find that a country which has any coverage, which is not high enough, with importations, you can get a spike of cases. In 2010, I was the outbreak response manager for the polio outbreak in Europe. And it came from India. It might have been with students who went to study in Tajikistan. From Tajikistan, it went to Uzbekistan, it went to Russia, and it took about 1 year of a lot of work in countries which had not conducted campaigns for almost 15 years. We had to start from zero to build the immunity to a level where we could stop the transmission of polio. So coverage at a small local level contributes to immunity and protection of the herd, of the group, which contributes to immunity of countries and which contributes finally to stopping of transmission, which we call elimination. And if we totally remove the disease completely, that's what we can call eradication, just like smallpox. So yes, coverage on these small areas contributes to immunity and herd immunity, so that sometimes even if you get importations, it could be 1 or 2, but it doesn't spread locally. And then when you have enough coverage and protection, and different viruses or diseases have different thresholds. For example, the measles threshold is so high that even if you have 80% coverage, you can have local transmission. Whereas, say, for example, for polio, I don't want to say that polio is less, but polio is 80% coverage can stop transmission of polio. So various like that. And so that is why we talk about the coverage and the need to have population immunity commensurate with the transmissibility of the virus or the bacteria in order to stop transmission and to effectively control diseases either through stopping transmission, elimination, or even eradication. Thank you.
Thank you for that, Doc Quezala. Doc Carla, for your answer.
Yeah, just to add to Dr. Quezala, improving MRO-PV coverage, it means first catching up on unvaccinated and under-vaccinated children with measles and polio vaccines and also other vaccines that are needed. Because vaccinating them as soon as possible before a widespread outbreak can occur, it can prevent that. So we improve coverage, we prevent outbreaks now, as mentioned, of measles and polio. And probably in the long term, if we sustain it, if high coverage is sustained at a global level, then we can probably finally eradicate polio and also add on the countries or areas that have eliminated measles. Because if you look at data also, some of the countries that have eliminated measles ay nagkakaroon ng backsliding. And again, there are cases of measles already. And even other countries with no polio cases, nagkakaroon na ng polio cases. So if we really improve on the coverage of these very contagious diseases, then in the long term, we can eliminate some of those and even eradicate like polio. And if we focus our efforts on the highest, on the priority countries, especially na nagko-contribute dun sa kunyari 70 or 80% of the unvaccinated children or under-vaccinated children, then meron siyang impact globally on mag-increase yung coverage. But again, it has to be sustained at a level na it will prevent transmission ng mga vaccine-preventable diseases like measles and polio. When it comes to the vaccination, because I think there's also a question on how important are vaccination campaigns from public health perspective. So like what we're doing next month sa May, yung vaccination campaign, yung supplemental immunization activity for MR and OPV. Very important siya kasi nga, ang baba ng coverage natin, daming mga batang hindi nababakunahan. So yung campaign would rapidly boost yung population immunity and prevent a possible outbreak. Lalo na pag nabakunahan, yung majority ng mga bata, 95% pataas, under 5, regardless of immunization status. So with high coverage, so we can possibly prevent outbreaks. But more importantly, lagi ko itong sinasabi, although SIAs or immunization campaigns are important to boost population immunity. But moving forward, we should really focus dun sa routine immunization na services. Yun yung dapat natin pagtuunan na yung mga nanay, mga caregivers, pumunta sa mga health centers kapag schedule na ng kanilang mga bata para magpabakuna. Kasi po, if we increase coverage ng routine immunization, hindi natin kailangang gumawa ng campaigns every 3 years, no? Especially for measles. So, yun po from my side. Thank you.
Ayan. So thank you, Doc Quezala and Doc Carla, for explaining to us what's the importance of vaccination, not only in the Philippine setting, but as well as to the global effect of this. So for our last question for today, this is for Doc Janice. Ano po ang targets natin ngayon sa MRO-PVCA po natin, at meron pa po bang ibang initiative ang pamahalaan para mabakunahan ng ating mga kabataan kontra sa mga sakit na ito?
Ayan. So ang target po natin sa ating MRO-PVCA for this year, so ang target po natin sa oral polio is nasa 10 million na bata na 0 to 59 months ay mabigyan ng oral polio vaccine, at nasa 9 million naman po na 9 months hanggang 59 months para sa measles rubella vaccine. So yun po ay team target natin sa nationwide, na dapat 95% pa rin sana ang mabakunahan para dito sa ating supplemental immunization activity. So other methods po kung paano natin sila mabakunahan. So bukod po dun sa ating sinasabing routine o yung regular na pagpunta po nila sa health center, so meron din po tayong polisiya na para po sa catch-up. So catch-up immunization. So meron din po silang mga microplans na ginagawa sa level ng LGU para kung sarili nilang strategy kung paano sila makapunta sa mga bata na hindi pa nababakunahan. Pero meron po tayong nabigay sa kanila na palisiya na dapat magkaroon ng catch-up immunization.
Ayan. So maraming salamat po, Doc Janice, for that. No, before we officially end our Kapihan session for today, again, we call on our speakers, Doc Quezala, Doc Carla, Doc Ana, and Doc Janice to deliver their takeaway messages to our public. Doc Quezala, Doc Carla, and then Doc Ana, and then Doc Janice po to give their messages.
Yeah, again, thank you very much for this opportunity. A lot of messages have been passed on. What we want to ask is that whoever is attending here, we need you. We need you to convey the message. You might be opinion leaders. You might be the people who, in your family, you are able to communicate something. And we need also you to be able advocates to the people who allocate resources and the community leaders that immunization is very important. Immunization has a high return on the investment, and immunization can be a preparedness for any future pandemic even. So for a strong Philippines, we need a good immunization program. So let's go out there and build a good immunization program, including the immediate activities of May and the routine immunization that is necessary to reach every child.
Thank you for that, Doc Quezala. Doc Carla?
Yeah, thank you, Nikki, and thank you, DOH, for inviting me and inviting us here. Siguro sa akin, ang aking message ay ang vaccination, ang immunization po ngayon ay nasa krisis. Tayo po ay nasa krisis pagdating sa pagbabakuna. Nasabi na po kung bakit po. So, ngayon po yung time, no, for everyone to really support vaccination. Kung nasaan man po kayo, kung ano man po yung inyong line of work, let us all support the government. Kung kayo po ay nasa private sector, magtulong-tulong po tayo para po maagapan itong krisis na to. Ayaw po natin na mas madami pang bata, no, ang magkasakit, maging disabled o magkaroon ng disability or mamatay dahil sa isang sakit na pwede namang ma-prevent. So ayaw na po natin yun, no? Gusto po natin ang ating mga bata, lumaki sila ng malusog, they survive, they thrive, and magkaroon po sila ng full potential nila na maging adults na and productive citizens of the country. So again, as I always say, no, ang mga bakuna po sa ating mga health centers, yun po ay ligtas, they are safe, they are effective, and more importantly po, yun po ay mga libre sa ating public health facilities. So thank you very much.
Ayan, maraming salamat po, Doc Carla. Doc Ana, for your takeaway messages po.
World Immunization Week, I'd like to take the opportunity once again to remind the public and our decision makers and our implementors tungkol dun sa kahalagahan ng bakuna. Alam nyo, sa araw-araw na course ng aking trabaho dito sa ospital bilang isang pediatric infectious disease specialist, hindi namin naiiwasang makakita pa rin ng mga batang nagkakasakit o nadidisgrasya dahil sa mga vaccine preventable diseases. So, meron tayong pagkakataon na masolusyonan itong problemang ito. So sana lahat tayo magtulong-tulong, lahat tayo bigyan ng karagdagang halaga, no, ang proteksyon na pwedeng ibigay ng mga bakuna sa mga bata, sa lahat ng age groups, at kunin natin ang pagkakataon na mabigyan ng pagkakataon ng a healthy future, no, for all Filipinos. Maraming salamat.
Ayan, maraming salamat po, Doc Ana. Doc Janice, for your takeaway messages.
Yan po. So, kagaya po ng sinabi ng ating mga guest po ngayon, so wag po kayong matakot. Inaanyayahan ko po lahat ng mga magulang, dalhin niyo po ang inyong mga anak sa inyong malapit na health center para po mabigyan po sila ng tamang bakuna. At kung hindi pa kumpleto ang inyong impormasyong nakuha ngayon, pumunta lang po kayo doon at bibigyan po kayo ng impormasyon ng ating mga healthcare workers na trained para sa pagbabakuna. Huwag po kayong matakot. Ito ay matagal ng bakuna at marami na pong na-save na buhay dahil sa mga bakuna natin. At gusto ko na rin pong ikunin yung pagkakataon na iulitin po yung ating imbitasyon para sa ating measles, rubella, bivalent oral polio vaccine, supplemental immunization activity. Next week na po ito, May 1 hanggang May 31. Magpabakuna po tayo kahit meron na pong bakuna noon, magpabakunahan pa rin po natin dahil ito po ay added na protection para sa ating mga anak. At para po maging mas protektado po sila at mas maganda ma-boost po ang kanilang immune system, meron po silang proteksyon at panlaban para sa measles, rubella at oral polio at polio. Maraming salamat po.
Ayan. Again, we extend our thanks to our development partners, the World Health Organization and UNICEF, as well to our expert, Doc Ana Onglim, and to our very own Doc Janice of the Department of Health for sharing us their time and expertise with regard to immunization of children. Muli, hinihikayat po namin ang bawat nanay, tatay, lolo't lola at legal guardians sa pabakunahan ng ating mga kabataan laban sa measles, rubella at polio. Ang mga bakuna po ang pinaka-epektibong paraan upang malabanan ang mga sakit na ito. Kaya naman muli, no, sa darating na May 1 to 31, samahan po ninyo kami sa Chikiting Ligtas, join the big catch-up, magpabakuna para sa healthy Pilipinas. Muli po, isang Juana mula sa Kagawan ng Kalusugan. Ako po si Nikki Nasasario at magkita-kita po tayong muli sa susunod na Kapihan with Media. Maraming salamat po, Doc Quezala, Doc Carla, Doc Ana Onglim, and Doc Janice at sama-sama po tayo sa isang healthy Pilipinas.
Thank you.
Thank
Thank
you.
you.
Bye.